big question.
Testosterone.
How do you increase your testosterone naturally?
In terms of diet and nutrient levers, seems to be very important. People tend to have a fear of the additives because they think, oh, as long as something is Ayurvedic or herbal or it's coming from my ancient roots, nothing could be further from the truth.
If you put a green color, everything is natural.
The glucose in the blood is perfectly natural.
Which is the best diet to live long?
The most clinical evidence in the form of multiple randomized control trials and epidemiology is behind the.
Do you think we have enough research on gut microbiome to come to any conclusions?
Because everyone's gut microbiome
Very different.
It's very different, and a lot of people got बहुत damaged है because of years of antibiotic use and a lot of factors in the diet and stuff.
So the best supplement for good skin
Is to start with. That's something that people should start by the time they come to 25, 30 because decline every decade. I feel the problem with the mainstream medical profession today is try to avoid the Dunning-Kruger effect. It's an impulse, but try to avoid it. Like for the first 1 or 2 years, you will become arrogant, you'll become cocky, you'll become dismissive, you'll think you know your shit and the doctors are all wrong and the entire world is wrong and you've somehow got the truth because you can see through all the shit.
Yeah. 3 habits that are non-negotiables for living long.
I would say in terms of biggest impact,
What are the most common problems that you see in your practice? Like when you see your clients, what is the most common thing that comes to you? Which you also see is very prevalent around people in your friend circle or like people around you.
take a guess.
I think vitamin D and B12 deficiency.
नहीं symptoms की बात कर.
Symptoms.
हाँ.
Symptoms. I think gut issues.
Yeah. Right there, nailed it.
Yeah.
Exactly that. It's the main thing that I see.
Oh.
Gut issues is like
and
every second person.
An issue also.
It's become very normalized. It's become
Yeah,
highly like IBS and stuff is like
people think कुछ गलत खा ले होगा, that's it.
That's what. So there are of course different degrees. Like I see patients with like inflammatory bowel disease and like a very worst end of gut issues, like chronic constipation for many years and like chronic diarrhea, bleeding in the stool, like constant abdominal pain. So there's different degrees, but by and large, like I think, and I get some of the worst patients that way because I deal with like a large multitude. So लोग मेरे पास ऐसे 10-20 symptom की list लेके आते हैं पूरी. So gut issues are almost always there.
But all the problems are rooted in some common thing or they're varied?
सबका बहुत अलग रहता है. There are some common deficiencies I see coming up again and again. Iron deficiency is very, very common in women. Like, and it's a huge cause of a lot of symptoms being off. Like just one iron deficiency can cause anxiety, problem focusing, drop in energy levels, low immunity, a lot of different shit like pale coloring of the skin. बहुत चीजें just because of iron being off.
These are important takeaways. Huh?
Yeah.
Like symptoms like people, when you say iron deficiency, now people will not know they're iron deficient until they get tested for it.
Yeah.
And they will not get tested because people in general, they don't really care about all these things. उनको लगता है कि सब normal है.
Yeah.
Now, what are the things to look at? Suppose if I'm a person and I have say, what are the symptoms to look जिनको देख के मैं बोलूँ कि हाँ मुझे जाके टेस्ट करवा लेना चाहिए.
Okay, so it depends on like what angle you want to approach this with. I've come to get a more practical understanding of this just talking to a lot of people like in the last couple of years or so. So many people I think they're just scared of getting tests done because they feel like it will add an unnecessary source of anxiety into their life. So I would say like just to address that mindset, I can see why people think that because oftentimes people will test, then they're not given concrete steps to fix the problem. They're just left with some free floating anxiety कि भाई मेरा ये high है, and then they don't get an exact thing also like which is evidence based to fix that problem. The doctor will just tell them workout करो, diet अच्छा करो, वो तो भाई वैसा भी करने. We all know that, So it doesn't like it leaves a person with more fear at the end of the day. Or someone might go get the gene test done. They might see they have increased risk for Alzheimer's or something. They just freak out because they haven't been educated about like what factors we can engage in to reduce the risk of those things. So that's one reason I feel. But people should understand that if you work with the right person who's deeply like invested in the field, who's honest, who really wants to help people, he can tell you like a lot of things that you can do in a concrete way. Once you find out कि ये risk है, we have the capability today to like stop heart disease or like drastically reduce heart disease formation, stop kidney disease progression, Alzheimer's like progression कम कर सकते हैं, cancer risk we can reduce in a meaningful way. So these aren't just like airy fairy things. Okay, even like diabetes and stuff, you can catch very early and stop it. It's just a matter of you should work with someone who knows how to interpret the labs, which is extremely complex. Like har ek cheez ka diagnosis, if I just tell you anemia diagnosis, like iron deficiency interpretation, it's so complex. Like people
So
will just look at
it's very
serum iron
complicated.
देख लेंगे वो लोग, but you have to look at TIBC. उसके basis पे calculation बनता है called percent saturation. You have to look at that. You have to look at ferritin. If both of them diverge, then you need to understand like how to interpret that as well, because many times there'll be 3-4 markers for a certain thing, both will point in opposite direction. So what does it mean if you're not a student? बहुत nuances होते हैं ऐसे.
But
So
these things are not to scare you or like
yeah,
not to confuse you, because people now after some point start thinking कि यार ये तो इतना सारा है और
हाँ,
उनको बहुत complex लगता है
yeah.
ये. But this is very important. But we are just trying to tell you the importance of these things. But if you are experiencing these things, these are not normal.
Yeah.
They can be treated without medicine and very easily. Just you need to be aware and go to the right person. That is what we're trying to say here.
And the most important thing is a lot of chronic diseases won't give you any symptoms. I'll give you an example.
Yeah, exactly.
कुछ भी symptom नहीं आएगा. Like if you have plaque building in your arteries,
Oh yeah.
and it's building and building and building, like when so you have the artery like this, and then you have plaque. First it starts out inside the artery wall. So even if you get like a scan or something, you won't see it, and it's still building up behind the artery wall. Then it will start to come inside the artery. You might see it in a scan. Okay. If you're not tracking this and it keeps building up, you're not going to get any symptom till that thing shuts. The blood flow stopped and you get a heart attack. It's fully symptomless.
The first knock on the door of a heart disease is a heart attack.
Seedha. Like this is not even hyperbole or anything. Like even for chronic kidney disease, we can catch it in stage 1. But most of it is not caught until it reaches stage 4, where the person starts experiencing severe fatigue and like vertigo and things like that.
So just being aware about these things.
And
just
this is
be aware about your own body.
Having the consciousness that you're going to have much more regrets later if you don't be proactive and put some effort into investing in your health. You're going to have many more regrets later, because we know we can look at these things and we have perfect tools to like bring it under control. And living in
trajectory.
And I'm also giving so much nuance on the markers so that people don't run tests themselves and try to interpret it themselves. थोड़ा बहुत basic like B12 देख के कर लिया, like nutrients के लिए इतना it's more straightforward than trying to interpret like thyroid or diabetes. Like it's much more complex to diagnose those than just looking at deficiencies. Even usme, like if you just go by the lab range, you'll think you're normal, but actually you can improve it much more. So that's the gist.
Another question that a lot of people feel and hear is inflammation. I want you to tell people, what is inflammation? What exactly is inflammation?
So whenever you have any damage happening in a tissue, in a cell, you have inflammatory cytokines that are released to clean up the damage or to bind to infections as well. Like if you have infection, like you get a certain cut or something somewhere, there'll be some infectious growth there. So there'll be these cytokines that will come and bind to these pathogens or bind to like the debris of the damaged part of the cell and clear it away. That is the role of CRP. CRP is C-reactive protein. Yeah, it's the most fastest thing to respond to any kind of inflammatory assault. That can be damaged, so like there's plaque buildup happening in your arteries, that itself creates inflammation. There's a cut or something somewhere, you get a minor infection or something, like your body is fighting pathogens all the time right now. So there can be like clinical level of inflammation. If you have oral microbiome, if there are changes, if you have cavities and stuff, these are all like minor causes of like smoking itself, causes some microinflammation on a daily basis. It's basically a term used to like define some like low level of wear and tear, and that can increase also. It can become like serious damage or something somewhere. So typically like CRP levels reflect कि कितना degree है inflammation का, and how severe it is reflects like risk of different diseases and stuff. That's a very simple kind of explanation of inflammation.
Now I'll get to the holy question that everyone is looking for, the answer for this question, which is the best diet to live long.
So there's again like
Yohan, which is the best diet to live long?
इसके काफ़ी like different sets of people, different communities online have different beliefs about it. So if you listen to the vegans, they'll tell you like the vegan diet is like the best for like long-term health. If you listen to like keto, carnivore people, they'll like convince you. So if you really don't know, like if you're not using the framework I kind of gave in the first half, you can land up thinking like people are credible if you take it at face value. But if you put it through the lens of the hierarchy that I described, the most clinical evidence in the form of multiple randomized controlled trials and epidemiology is behind the Mediterranean diet. So Mediterranean diet is one of the only diets which has reached such a stage where we have meta-analysis of RCTs for that, and some of these RCTs have spanned for years, by the way. So that's one of the most evidence-based diets to reduce heart disease risk. And when we're thinking about like living a long, healthy life, we want to think about achieving that by delaying the onset of chronic disease.
Exactly.
Okay, that's the primary thing we're focused on. So you have to basically take the top 5 or top 10 killers and figure out कि इसको prevent करने के लिए मुझे क्या देखना है blood work में, मुझे क्या interventions करने हैं. If you just focus on optimizing those key biomarkers for these diseases, you'll automatically extend your lifespan. And then there's some, lifespan extension research is not something we can do at humans at this point. We're getting some clues from genetic studies, and then there are some animal studies which are being done which are giving more clues and stuff, but it's at there. And then there are some indirect biomarker studies looking at certain compounds, decreasing the rate of aging. वो सब में बहुत caveats है. Those biomarkers aren't like very causal. They fluctuate from inflammation and other things. Also, like all these, Brian Johnson and all these people have, like their aging scores and stuff. It's not so straightforward to interpret these. There are some other factors other than those things which impact the rate of aging. Primarily, what we know of for like lifespan extension, I think the most amount of data is to enhance your cardiorespiratory fitness. That's like consistently we see, and it's a linear effect. Like jitna zyada you improve there's something called VO2 max. That's a measure of how much oxygen you can uptake at like any given point in time. So we've seen it in large scale studies. Like the higher that is, the longer people live. Yeah. So ऐसे long term studies are there even for like just longevity on stuff, looking at centenarians and things like that. They aren't perfect, but in general, like a Mediterranean style diet, let me describe even what that means, because otherwise people just think like olive oil डाल दिया किसी में भी Mediterranean diet बन गया, ऐसे नहीं होता. So there are pillars to the Mediterranean diet. Okay, it's mainly based on whole grains, fruits.
It's coming from Yohan's mouth.
Yeah, whole grains, fruits, vegetables, nuts, seeds, fermented foods. These should be making like the pillars of your diet. And we again I think we talk about this later, but one thing I've changed my mind on recently is getting convinced that there is very good evidence showing us the benefits of plant protein over animal protein as well, and there are various reasons, and mainly I came to understand this further after realizing the value of prospective cohort studies and like how these adjustments are made. And commonly I used to believe earlier by listening to a lot of people, because I didn't know how to read the studies myself, so a lot of people would say okay, yeah, there is an association seen with red meat and like colorectal cancer or heart disease or whatever. But they would give the argument that it's just because people are drinking more or smoking more. But when you have studies which are adjusting for all those things and still the associations are seeing, you have to put your head in the sand to still deny that data. और ऐसा नहीं है कि थोड़ा खा लिया तो उससे होगा. There seems to be a limit at which there is a increase in risk. So that seems to be like somewhere like 350 grams a week or more than that, we start to see increase. Whereas under that limit, like if you're having 50-60 grams stuck in a day of animal protein, like there's no increased risk that's seen. So then even like the plant-based people will just say like, oh, red meat,
50-60 grams of protein.
Animal protein. Animal protein.
Animal protein.
Yeah.
Not the absolute 50-60 grams of animal food. 50-60 grams of animal protein.
Of animal food.
Of animal food.
Yeah.
Right.
The weight
of the food.
Red meat. Yes.
All right. Cool.
Yeah. So this became like much more clear to me because we have like long-term prospective cohort studies now replicated. So we have multiple of these looking at like 40,000-50,000 people, where they are meticulously done. Like there's a nurses health study, there's an other one also where they are looking at long-term like intakes of people and adjusting for different things. They're adjusting for fiber, they're adjusting for fruits and vegetables, they're adjusting for smoking, drinking, like common things you'd think would affect the result. They've even compared plant versus animal protein. They've even come up with something called the plant to animal protein ratio. So these are like now we're starting to get biomarkers.
So is there any specific range of plants to animal protein ratio that a person should strive for?
Yeah, from what some of this research is new, so it'll take some more time to solidify. But from what I've read recently, it seems to be around 0.75 to 1. Yeah, like a ratio, like 75% to 25%.
Oh,
of
so
a plant.
75 is a plant
Yeah.
protein and 25%
Yeah.
is on animal protein.
And there was one brilliant study where they looked at markers of healthy aging. So they looked at long-term outcomes. As I said, like prospective long-term epidemiology studies can give us an idea about what happens over decades. You can't catch those things with randomized controlled trials, and you're trying to bridge the two. Why I'm convinced with this data is because it's not just observational studies, but even the meta-analysis on the Mediterranean diet, which is mostly this way of eating where you're prioritizing like plant protein and stuff, and like minimizing red meat. So out there also we see
But
Mediterranean
white
diet.
meat, fish and all is eaten in Mediterranean
So within
lifestyle
that, it's
diets.
not like all meat is equal. So red
But
meat,
yeah.
red meat tends to have the biggest associations. Processed red meat tends to have the
Oh, that's
clear
yeah,
associations.
that's a different ballgame
Some
altogether.
of the harms of red meat tend to get adjusted if you increase your fruit and vegetable intake and fiber intake, but it doesn't take away from all the risks. White meat seems to have less risk than red meat. Eggs is very controversial, depends on genetics. And fish is protective. Seafood is protective. So again, it's very nuanced even within the meat spectrum. So
No,
if you're
so out of the, so you said 75 is to 25.
Yeah.
The 25 may say the 25 is complete animal protein, right?
Those studies have not
Or
yet
25% is only red meat.
वही कह रहा हूँ. Those studies, the ones which came up with this ratio, I will have to dig into the specifics to see like what comprise the animal protein group. That's why I said like we still need like more digging of that to solidify, and some of this research is new. But in general, we know for sure that from this one couple of studies I was telling you about, they looked at outcomes of chronic disease and also looked at markers of healthy aging. So just like frailty and like mental performance and things like functional markers as well as chronic disease. Plant protein had like serious advantages, even comparing calorie to calorie from like plant to animal, like plant protein. And I would be the last. I would be the last person saying.
I'd love to dig into these studies.
Yeah, bro, I'll send it to you. And even up till recently, like I didn't appreciate the value of epidemiology studies. But to be honest, like even when I'm teaching blood biomarkers, like most of that research is all coming from epidemiology. Right, where we're seeing associations. कि भाई ये marker है, इसका ये range है, and we're seeing these outcomes that way. So yeah, it is strong evidence, but ideally you should confirm it with RCTs. We have that for the Mediterranean diet. So I would say like that style of eating is what you want to focus on, like mainly like fiber, fermented foods. Main components, see, like you can even understand why the diet is so helpful because we understand the role of LDL. Again, like probably expand, but now it's very, very clear. It's like the highest level of scientific evidence you can have is for LDL being like a primary, driver. So it's very easy to understand once you just see, like once you understand that saturated fat and fiber are the two main dietary things that influence LDL cholesterol. It's very easy to understand why these foods would even have like a long-term effect on that. But again, that would be like more of a mechanistic argument. I don't want to make it based on that. But once things are proven, this other insight I wanted to give, the mechanistic data becomes important. If we've proven something in an RCT or in observation studies, then you look back and try to understand कि कैसे हो रहा है. That's where the mechanistic study helps.
Every outcome will have a mechanism.
But every
mechanism cannot have an outcome. Yeah, true.
Exactly.
What's your take on importance of protein?
Really, really important, mainly from a perspective of preventing sarcopenia. So falls and stuff tend to be a primary like factor for why a lot of people elderly people land up in the hospital and end up having premature death. So by optimizing the protein intake, and once you get elder, you have to aim for higher. So it's maybe like there are some specific studies looking at total amount of protein versus like suboptimal protein from plants. So they found that like aiming for like optimal levels is better than not getting enough that way. And plant protein pe ek aur nuance hai that if you're aiming for what athletes and people doing exercise are aiming for, so I'll give the numbers. 1.6 grams per kg of body weight is what you should be aiming for if you're old, if you're working out, or if you're doing some kind of endurance exercise. It's 1.6 grams per kilogram of body weight of protein. So you just take your weight in kilograms, you multiply it by 1.6. That's how much protein you should be getting if you're on these categories. If you're not and you're just like a regular person, sedentary, like not working out, then it's 1.2. Okay, and the RDA is 0.8. So ideally aim for 1.2. And then as you start to get older, we need higher. If you're getting plant protein at that 1.2 area, probably good idea to aim for like 0.1 to 0.2 more. Because so I changed my mind on this as well. I think I sent you these studies, but they've done some interventional studies comparing animal protein to plant protein, matched for protein, matched for calories, same strength training regimen for I think 2 to 3 months or so, and they saw like a couple of studies, not just like one interventional trial, but they saw same increases in like strength and like actual growth
of the
in
muscle.
terms of 1 rep
Yeah,
max or like different things which are
actual
measured.
performance.
Yeah, in terms of performance aspects. So if you're aiming for 1.6 grams, there doesn't seem to be a difference.
Oh, yeah.
But there might be if you're aiming for lower protein, so it might be just a good idea to 0.1, 0.2 say बढ़ा दो if you're getting the
Just.
basic.
All right.
Yeah, those are the like important nuances, and try to focus on plant protein. Like we'll name the food so it becomes more practical. This is the much dreaded soy,
Yeah.
tofu, tempeh, edamame, lentils, chickpeas, black beans. Yeah, that's the studies mein, when we say plant protein, the groups are mainly having these foods.
And according to you, what are the most important blocks that a person needs to focus on for living long? Like we had just had a discussion about which protein to have. Is it like people get into the nuances of things and start thinking that oh, plant is better or this is better, that is better, that is better. I want to tell people what are the big rocks? Like what are the bigger things that you need to worry about? Like if you're not getting the enough protein number, you should just first focus on that rather than focusing on where are you getting
Where
it
are you
from.
getting from? Sure. You have
So
to
what are
take
the
steps
yeah?
to
So
get
what are
towards
the
your.
bigger blocks that people need to know that oh, these are the bigger things that I need to focus on rather than focus on the small things.
So it's the pillars of health
Yeah.
that are very important. So when we talk about diet, I've already mentioned like you want even salt is something I've changed my
No,
mind
but
on
dietary wise only
quite
I'm
a bit.
saying like
Yeah.
what are the top three things that people need to
Okay.
like, these are the things that I need to focus on the most.
Keep saturated fat under 8% of calories. Okay, that's very strong advice I would give. Like limit the saturated fat, limit the salt intake. So I used to think earlier that less salt is also a problem. My confusion on that, because again there were some observation studies showing that it's a U-shaped curve. Like if you go less, also it's a problem. If you go more,
More
also
is
it's a
also
problem. Those studies were looking at single spot urine measurement of sodium. But when we look at 24-hour where you're collecting someone's urine over 24 hours, multiple times, it's a direct linear increase. Like जितना ज़्यादा salt खाओगे, उतना linear increase in blood pressure and outcomes. So like limit salt again. Ancestral salt intakes were much lesser than what we're having. I wouldn't use that as an argument, but just like even if you look at older populations, like they were having much less salt than we're having today. Increase polyunsaturated fatty acids. Okay, and then like in the terms of the diet, like what I mentioned, like fermented foods should be important part. So this would be like kimchi, sauerkraut, kefir, yogurt,
pickles and
pickles. These should be center stage of the diet. Fruits and vegetables should make up a lot more focus on like vegetables, whole grains, also like healthy whole grains like oats and like wild rice varieties, quinoa, like all these things are really good for us. They've been demonized for different reasons, which probably get too technical. Don't want to touch on that. But these are healthy foods. There are a lot of kind of you can say knee-jerk reactions people have when thinking about that. Okay, this has phytates or this has lectins or whatever. But like
those are I feel those are secondary arguments. Like the first
no, and
basic things
they're
are
unfounded arguments. That's what like
first you need to focus on like the bigger pillars
core
of that's it. Yeah.
core pillars. So
Yeah.
mainly like target the protein intake to be what we mentioned, like fiber aim for 30 grams minimum a day, and then if you just center your diet in this way, you limit your salt intake, you try to limit your animal food intake. This is something I suck at also because I've just been recently convinced in the last couple of weeks. So I'm a huge animal food lover. So even for me, I'm just trying to focus more on seafood and like white meat compared to red meat. And some of the risks you can bypass. Like once you understand the mechanisms for how red meat is really causing damage, it's mainly by increasing LDL, ApoB levels, and the lack of fiber and some other things like lack of polyphenols and all of that. So if you're plugging some of that and you know, okay, ठीक है ये biomarker देख के मैं कर सकता हूँ, then you can mitigate the risk. But I wouldn't advise that to anyone in the lay audience to do that because you need a lot of like knowledge about the field to kind of look at the blood work and then assess. So it's better to just avoid it and follow these guidelines till you get to a place eventually, or you work with someone who can then
get your proteins,
aim for the fiber,
get your fiber, limit your saturated fat intake.
Place special importance for polyunsaturated fat. Make sure the omega-3s are there. That's another important piece. So for that, like aiming for like couple of servings of fatty fish a week, or just like taking omega-3s. Those are like the core pillars, I would say,
say, yeah.
overall, like of a good dietary pattern that's good for long-term health outcomes. Again,
Yeah.
see, like a lot of people cannot tolerate fiber because they have gut issues. We have studies now
Yeah.
where we're seeing
I'm one of them.
differential responses to fiber. Okay, so I have seen this like one recent RCT which was done, like assessing the impact of increasing fiber intake of like different groups of people. So they found like one group had an anti-inflammatory response, one group was neutral, one group actually had a pro-inflammatory response to increasing fiber intake.
Fiber intake, yeah.
And there are various like reasons this researchers have thought. So abhi to initial stages mein, now based on these trials they'll design more to confirm ke bhai, what kind of protocol can we develop, we can increase the fiber intake, like is there some preloading phase where someone needs to have more fermented foods, because everyone's gut microbiome
Very different.
it's very different, and a lot of people are बहुत damaged there because of years of antibiotic use and a lot of factors in the diet and stuff which have damaged our
Do you
microbiome.
think we have enough research on gut microbiome to come to any conclusions?
There is broadly in the
Or
research
we just know
what
that
we
there
know.
are changes, but we don't know what they do.
So if we think of the hierarchy, then I would say the most evidence is for alpha diversity, where we want a broad diversity. And again, if you go into
But
the
these are very
research,
generalized thing. Like what I'm trying to tell
if
is
you
that,
go into the research, they will even name the species
Okay,
and stuff
okay,
for you.
okay.
You can test these things. So it's a good idea to like aim for alpha diversity, and then there are some certain interventions which we know increase alpha diversity, like increasing fermented food intake and stuff. They will introduce
Yeah.
different
But
species.
there's a lot of nuance to this topic, I feel.
Within them,
Within
क्या है and उसके क्या impact होता है. So for the gut microbiome research, for some microbes it's very clear. Like H. pylori, there's a ton of research. Ton of research. Like it's very clinical. If it's high, we know the implications: increased gastric cancer risk, increase in like atrophic gastritis, like stomach inflammation and stuff. There are certain outcomes we know, that happen if you have a H. pylori infection. That when then there are interventions we know both in the natural medicine world and in the allopathic realm. कौन से antibiotics use करने, you can screen for antibiotic resistance. Accordingly, you can use interventions. There are natural things also which have been shown to reduce levels. So for some microbes, the research is very strong.
Very strong.
For certain parasites like blastocystis, for certain fungal pathogens like candida, even for certain probiotic individual strains, there's tons of randomized control trials, tons on individual strains. It's like if you're talking about vitamins and minerals, probiotics is a full different field.
Oh, that's
altogether.
yeah.
और उसमें फिर not just the name of the strain, but even the sub species. Like let's say, a lot of people must have heard of lactobacillus, bifidobacterium. फिर lactobacillus के अंदर भी like there are multiple types. वो एक type के अंदर भी there are different subtypes. So and then depending on the ones we use, it's like a different clinical effect. Some are effective for mood, some are effective for diarrhea. So there's very good science, and when I say very good science, I mean proper interventional trials where we're using certain things, a certain CFU, and we can measure the changes. We can measure these things with tests. So I would argue that it's that to like a very reasonable degree where you can actually apply it in people, but you need a deep understanding of all of these trials to be able to customize the strains to the person's symptoms. You can test them to get an idea about what might work. So something that can be clinically applied.
All the guys want to know the big question: how do you increase your testosterone naturally? I want you to focus on optimal levels of testosterone first. What is the ideal range? What should be the range? And can it be increased naturally? And if it can, how can we do it?
Okay, so various aspects. First thing we just touched is measured at the right time. Measured between 10 to 10:30. And testosterone evaluation also a bit complex. So you cannot just look at total testosterone.
Because, I want to add to that.
So testosterone is bound to albumin and sex hormone binding globulin. So like zoom out a bit. Albumin and sex hormone binding globulin are proteins in the blood which bind to different molecules and reduce their bioavailability, like reduce the amount that can actually go to the cells and perform their function. So sex hormone binding globulin is a compound which has the strongest binding. मतलब उसके level ज़्यादा हो गए, तो if that's high,
free testosterone.
Yeah, you won't have like enough free testosterone around. So even if you have a high or normal total, you can still have symptoms of what's called hypogonadism, where you like have like low libido and like low energy, erectile dysfunction, things like that, from having like low testosterone levels. Even if you like look like you have a normal testosterone.
Yeah, I wanted to mention that. Look, these factors, it can be there even if you have ideal levels of testosterone. Yeah.
Yes, yes, and that primarily depends on the free testosterone,
Free testosterone, yeah.
evaluation,
You
which
just
is
tell me
not
what
which
is free testosterone?
why
What do you do?
yeah. So we have sex hormone binding globulin, then we have albumin. Albumin is a common protein in the blood, which is a weak binder. मतलब albumin से जो testosterone bound है, it can get released easily.
Easily.
It's not as that tightly
Tightly
bound.
bound.
So that one is more available than the SHBG one. So like 40-45% albumin से bound होता है, another 30-35% is SHBG, बाकी is free.
Free testosterone.
So okay, this can get as technical as you want to make it. This is the breakdown of total. For free testosterone, I just landed up discovering couple of weeks back that in the studies there are two types of free testosterone.
What?
There's one
This
that's
I never
calculated directly.
This I never knew.
Okay, based on उसमें भी direct वाले में भी तीन अलग lab technique है उसको calculate करने के लिए. You can have slightly different ranges based on that. And there is calculated free testosterone, which is coming from an equation based on sex hormone binding globulin. So दोनों की ranges पूरी अलग है.
Let's
So
just
say if you
let's zoom out to talk
वही
about
है.
free testosterone.
So
That's it.
I'll zoom out and consolidate all this. So looking at when you're thinking about free testosterone, ideally it's best to get the value that's derived from SHBG, which is based on a calculation. अगर वो भी नहीं कर पाए, then just get the direct free testosterone. From top of my head, that's supposed to be above 7. Once you start to go under 7, the direct measured one.
Okay.
वो calculated one की ranges अलग है. So I'm just talking about the direct measured one, which is
But
cheaper.
significance का तो free testosterone नहीं है ना हमारे लिए.
That's what I'm saying. There are two different ways of arriving at free testosterone.
Oh, okay.
And the ranges for both of those are different. Because they are not measured in the same unit.
But and these two have separate tests in the lab?
Yeah, they are not interchangeable.
Okay.
वही तो है. Like it's a big rabbit hole.
Yeah.
So if you're looking at direct free testosterone, ideal to keep it above 7. Starts to go under 7, there's increased risk of like diabetes, heart events and stuff. For total testosterone, for mortality, I've seen best benefits from the studies in the future outcomes being above 650.
That should be the ideal goal.
I haven't found any paper के 650 से ऊपर भी कोई level है जहाँ पे आप और बढ़ाओगे तो you'll see more benefits.
Benefits only.
650 seems to be the highest place. उसके ऊपर है और you seem to be maximizing all the benefits of testosterone. 550 to 650 you start to see like less, you can increase all cause mortality overall, like risk of dying just goes up a bit. Start to go under 550, heart disease के some markers start to go up. Start to go under I think 380 or so, the risk of depression, erectile dysfunction ये थोड़ा बढ़ता है. And it's like a gradual decrease. जितना कम जाओगे उतना और severity बढ़ेगी. You start to go under 200, then we start to see like most of the participants in the studies have proper loss of libido, erectile dysfunction, things like that. So it's a gradual thing for any marker, but this is the way in which you should look at.
What is the symptom that a average guy should have कि मेरे को मेरा testosterone के test करवाना चाहिए? क्या symptoms क्या होंगे?
Low energy levels, low libido, like sex drive will plummet. You won't feel like aroused just by gentle things as like anyone else would. Erectile dysfunction, like if you're with a partner, like hard time getting it up. Depression slightly can be linked to like testosterone. If you're a bit more geeky, if you have insulin resistance or any kind of diabetes, that can be mediated by like lower testosterone levels. And primary symptom wise, I would think of those things.
मैं lab में गया and if I got all these things tested and I have low testosterone.
अभी उसको
now,
कैसे बढ़ाएं?
Can I naturally increase it?
Yes, you can. There are certain nutrients that you can optimize. Low hanging fruit.
हाँ yeah, low.
उसके भी पहले there are lifestyle things you can optimize, which are proven in research. कि if you optimize it, you will increase your testosterone. Not just correlations, but we know in trials कि भाई ये ठीक कर लिया lifestyle में, so their testosterone levels went up. Keeping everything as the same in the diet or whatever. So alcohol is a big one. Like cutting down alcohol intake if you're having it, that itself will increase testosterone. Like improving sleep. If you have sleep deprivation, that is a very huge factor for having lower testosterone levels. So just like fixing your sleep, getting adequate sleep and sleeping on time, getting the circadian rhythm piece in check, that will increase your testosterone. Those are main lifestyle levers to pull. In terms of diet and nutrient levers, vitamin D seems to be very important. If you optimize your vitamin D, it will increase your testosterone levels. Zinc seems to be quite important. Vitamin A पे थोड़ा research है. So these are like the main, I would say, nutrient diet related things that you can push and increase your testosterone further. So
particular food that you would recommend or just focus on these things?
Any food or lifestyle that's giving you like these nutrients. Firstly, like it will impact you if these are deficient. if your vitamin D levels and zinc levels are already good, उसको और बढ़ाने से you won't see
फर्क नहीं
increase.
पड़ेगा.
You'll फालतू waste your time thinking कि
And
भाई वो
money.
बढ़ा लिया testosterone तो भी same है.
Hmm.
So if these are deficient, if you optimize them, you will increase your levels just by optimizing these nutrients. When we talk about supplemental interventions, I would say DHEA optimization is the main thing to focus on. So you can measure your DHEAS levels. अगर वो कम है, if you use DHEA as a supplement, you will increase your DHEA, and that's the best way to improve testosterone overall. This is something that has meta-analysis of randomized
What is
controlled trials.
DHEA?
DHEA is a long name of a hormone that even I can't pronounce, but it's a precursor to all the other sex steroid hormones. So DHEA makes testosterone, makes cortisol, makes like estradiol, progesterone, DHT. Everything is made from DHEA, and DHEA के पहले भी pregnenolone आता है. उससे पूरा फिर like hormones all are made from DHEA. So DHEA declines with age. Okay, like chronic stress lowers it, hypothyroid lowers it. There are various like functional causes for like why DHEA levels decline. Autoimmune disease होगा तो उससे like DHEA deplete होता है. So just optimizing your DHEA levels is the first most natural and simplest way to like optimize your testosterone. That's what I do first. Okay, and just by doing that only, like it's it. And the thing is, DHEA is banned here. So you're not going to get it over the counter. You have to order it from iHerb. The dosing is very complex. Okay, some people they can have 25-50 milligrams, and again, this is not medical advice. Don't try this on your own because DHEA supplementation can have side effects. कुछ लोगों का DHT वगैरह ज़्यादा बढ़ जाता है. They get acne or like hair loss and stuff. So again, this is not something you can just randomly take over the counter. The dosing is extremely nuanced also. It depends के level कितना है उसके हिसाब से then you have to dose it and stuff. So I can't like really guide on that, but just work with someone who knows how to optimize your DHEA levels. उससे testosterone like automatically I've seen it again and again in clinical practice, like very easily, like steady state way में जितना DHEA बढ़ा उतना
बढ़ जाता है. मतलब like the guy should not figure because guys get anxiety man when they see low testosterone. They're like, is there any problem with me? But it's curable. Like you can take it up.
And DHEA has tons of research. Tons. It's been used in AIDS patients. It's been used in like women, men, older men, younger men. Like DHEA has tons of trials. When I say tons, I mean tons. Like at all doses.
I believe when you say tons.
50, 100 milligram, 500 milligram. All of it has been tested, and if the levels are low enough where they need a higher dose also, it's all safe and like good to go.
Does Shilajit work?
Bhai, if you think about the hierarchy, like it just has I think one RCT.
That's it?
Behind it. So
yeah,
just max 2.
Why
only one RCT.
So bullish on Shilajit?
I think it's I've actually come to get a deeper understanding of this, interacting with a lot of people in like Ayurvedic circles, and like even some people join my course. So I teach, I have students and stuff. So some of those people out there are like from more Ayurvedic or naturopathic background. So you see people's biases come up. People. I think some people believe that modern science is just proving what our ancestors knew all along, and I think that's quite a fallacious stand to take, because you can cherry pick the one or two things that got proven, like curcumin or ashwagandha. We have tons of trials for these things, but for every 2-3 compounds you can find there are hundreds that don't have any, and they're only at the level of mechanisms and things like that. So I mean it's generally that people want to think this has been used. They tend to think that something's been used for centuries and people found effects, it must be having efficacy. But this is the problem with like looking at ancestral claims or things like that. It's even weaker than looking at the neighborhood example because you don't have any data tracking, you don't have any adjustment for variables. There's too many question marks. It's just like
anecdotes.
People can make stuff up about things in the past. So you typically want to look at these kind of things to confirm higher levels of evidence. Like I gave the LDL example, our ancestors had lower levels. So we know today that like LDL pe itna research hai, like all the 3 bags of evidence I told you that I want to see are all there for LDL. So after that, if you look at ancestral populations, it's very surprising. I think I even sent you this like on WhatsApp, but I was surprised, like all the people who promote saturated fat and like butter and ghee. When I say saturated fat, we mean like butter, ghee, coconut oil. Okay, that's the saturated fat category. So typically all the people who promote that, they will tend to look at, say, like ancestors had a much higher intake of ghee. Yeah, हमारे India में तो butter और ghee is like people are drowning in that and stuff. So when you look at actual ancestral populations, dude, the total cholesterol is like 120, 130, which would correspond to an LDL of like 50 to 70.
Yeah, that's true.
Yeah. So
But do you have data based on like what was the LDL levels or these things of our ancestors?
that's what I'm saying. Yeah, not you can't get it for the
I mean,
ancestors.
how do you measure, or like how do you come to that conclusion?
So there are two researchers. One is Boyd Eaton and Lauren Corden. Lauren Corden was the founder of the paleo movement. So they've done a lot of studies going to hunter-gatherer populations living in the modern world,
All right.
and then like measuring the total
All
cholesterol.
right,
That's where this data comes from,
Why
and
is that?
it's not just for like certain populations, but it exists even for like Australian Aborigines, for the I think Hadza, for the Inuit. Like even all these populations like who we think had higher saturated fat, like they had very low LDL cholesterol. Yeah, yeah. So I mean that's where that information is coming from.
What are the best supplements for good skin?
Okay,
I
so
want to
I've
improve my skin.
personally struggled with this a lot.
Yeah.
So I've done a lot of deep dives in this area to like optimize my own skin health and stuff. So the most evidence-based things in terms of improving wrinkles, skin hydration, skin elasticity, is to start with collagen peptide supplementation. Again, like a lot of people online saying it doesn't work, and like they'll compare it to whey protein and they'll look at like joint health or something. But there are different types of collagen that are supposed to work for different outcomes. So for skin, type 1 and type 3, these are the studied forms which improve wrinkles, elasticity, hydration, these markers of skin health. And the trials use dosing anywhere as low as 3 grams all the way up to 20 grams. Like it all works. So find the thing that suits your pocket. And that's something that people should start by the time they come to 25, 30, because collagen levels decline every decade naturally. So if you just wait till you get old, then your skin will like get extremely thin, and you start to have more issues with that. So that's very important. Another thing is to use sunscreen and to avoid the sun at least on your face. So again, this is like fully. So it's not to demonize the sun. The sun, it's kind of like demonizing a certain part or compound of a food. So both like vegan and carnivore people do that to the foods they dislike. They'll say like your spinach is really bad high in oxalates, so this it's poison. Or the plant-based people will say, oh, red meat is high in TMAO or heme iron or whatever. You can find a compound to like demonize.
In anything you can find a compound.
Similarly, like people just focus on UV and then demonize the sun, while they ignore like near infrared light, other aspects of sun which like kind of balance the effects of UV. But if we look at sunscreens, and you can use like a mineral based one, you don't have to really use a chemical based one. Like zinc oxide ones are also available. So we find that there are some research showing that people who don't apply, like you look at their skin, and the area where they applied it on is like that's different if you follow them for a couple of years. It's not so UV is like the assault, and then there are internal factors that can improve your handling of the free radicals. So there's some studies on carotenoids like lycopene, lutein, zeaxanthin, astaxanthin. These improve the resilience of the skin to like the UV. So it's not like it's just the external thing that's mattering. You can increase certain factors inside which will reduce the UV damage. That's also happening. If you optimize your like reduce your inflammation and stuff. So all of those things have evidence behind it, especially astaxanthin. But if you take astaxanthin at a really high dose to have like the inflammation lowering benefits and things like that, so that's another thing that's very powerful for skin health. Hyaluronic acid has good trials behind it. The effects is minor than these two, but does have an effect. Then it depends on kind of like the specific skin condition. Another compound is gamma linoleic acid, omega-3 fatty acids. You can easily optimize for these. So things like borage seed oil for gamma linoleic acid, then for omega-3s, like just general like good fish oil at a high dosing.
Omega-3 works on a lot of things.
Yeah. Omega-3 is very like one of the most evidence-based supplements. I would say this is like my frontline for thinking about skin issues, and then I see other skin clients also, depending on whether someone has psoriasis or eczema or seborrheic dermatitis or rosacea. There's different ones. So then that's a
different
conversation.
altogether.
But if we're just talking about normal skin health, then these are the things I would focus on.
And what would you like to say to people who focus so much on small things like which water to drink, alkaline water, black water, this water, that water, chemicals in food, this chemical in food, this will cause this, small things. without focusing on the bigger rocks that we just discussed, like protein, like fiber, like fruits, like vegetables, and like all of these things. So, what is your message to these people?
This is called majoring in the minors, like in our circles. So it's when you get hyper focused about tiny things, which are all at the level of mechanistic research or animal studies and stuff. And because your effort is going so much in those tiny things, your focus land up like going away from the main things you have to optimize. I'll give you a practical example. So for heart disease, a lot of people online spread these ideas, case the inflammation, it's the insulin resistance, and like other things that increase heart disease. And if these things are fine, then LDL is not important. And then based on that, people just like ignore LDL after doing a ketogenic diet or something, and then they're like LDL shoots up, and they think baki sab like I lost weight, my inflammation went down, so I must be good. That's what they think. But if you don't understand the things which are major contributors, and then the things that are like tiny kind of adding up, your whole decision making will change, and based on that, like actual outcome will change. You'll end up thinking you're fine, but you actually increase like the biggest factor out of all of them, so it's impacting you. Similarly, when you think about long-term health, what I mentioned are the core pillars. I don't want people to get the impression कि ये core pillars follow करोगे तो सारे symptoms ठीक हो जाएंगे. These are the core pillars. These are the core pillars to optimize long-term health, to reduce your risk of chronic disease outcomes in the long run, like cancer, heart disease, Alzheimer's, these major chronic diseases.
Fundamentals.
Reduce their risk. But for symptoms, it can need a very targeted, specific approach. Like a lot of people's symptoms can get improved just by this, but many times you have to like find out nutrient deficiencies कौन सी है, फिर इनको optimize करना है. So I would say you should start out with the majors first, like the dietary factors I mentioned, the lifestyle factors like cardiovascular exercise, strength training, getting optimal sleep, stress management is super important in all of the literature. So getting like some kind of like stress relieving practice,
emotional,
whatever, like
stress management
works.
is emotional health.
Well, not just that, but even like handling your mindset and overall like outlook in life, and all we have trials looking at all of these mental emotional states also, and how they impact biomarkers which then mediate our risk. It's not just like some airy fairy thing where some quack will come and tell you, like just think positive or something अच्छा हो जाएगा. But actually, we see it. We see it very clearly, like how it impacts cortisol and like gut health, and like it's a very complex thing. Like to look at the mind's effect. There are a lot of studies looking at pain perception also, and just like people's belief of things like actually causing pain when there's nothing.
Pain management is a different ball
alag
rabbit hole.
So yeah, like focus on these things first. I'm not saying that the minors are not important. I think of it as a step-by-step approach, and how much bandwidth, and how much money someone has. So don't. A lot of people, they listen to podcasts. आज trend बन गया है, like CGM ले लेंगे. Like people will buy a CGM. People will like start thinking about all these tiny things in their food and stuff. And no one's saying, like, for example, if you were to generally get dismissive about being a bit cautious about ingredients that might show us risk in early research, you again, like, it's not about taking the opposite extreme attitude also and just dismissing things in anecdotes or cell research, but it's just about being slightly cautious to the point where first you optimize like the major things. If you have more bandwidth and time and money after that, then think about going further. And you can go step by step as deep as you want. You first start with optimizing the bases. Like I see a lot of people trying to fix some biomarker, but they're having tons of saturated fat, they're having tons of salt, they might be having processed foods. Like they're doing the basics wrong. Like fiber intake optimized nahi hai. Like they're having too much meat, less plant foods. Like all of these things are first bases. Like fix these things first. Then you can get to a point where you're measuring the blood biomarkers, get it interpreted from someone
the nitty-gritty of
knows what they're doing. Then you can try to optimize the biomarkers. Uske bhi aage jana hai. Then you can think about microbiome testing. As I said, there is data for that. You can test and optimize. There's data for targeted amino acid supplementation. There's data for like assessing genetic risks and then personalizing things further, because we can assess like kaun se areas mein genetic weakness hai, can push those things earlier. So it's like going from that to this in order of how much time you have, how much mental bandwidth you have, how much money you have, and while having the capability to not get stressed out as you go deeper.
These things,
because if you take too much stress by trying to focus,
you're missing the point again.
You're kind of like the benefits you get might be less than
Mitigated
the
by
harm, the
yeah,
stress,
yeah, true.
and the hyper. Like, this is a disorder today. Like, people get obsessive about eating and then just avoid large dietary groups because they fear, like, oh, this almonds have cyanide, and like, nuts have phytate, and this food has oxalate. So you just land up fearing foods.
Yeah,
When the important concept is the effect of a food is not dependent on any single one constituent. It's the net outcome of like different things in a food and the dosing of that. It's a very similar conversation even for the like additives and ingredients.
that was
Yeah,
my
but
next question.
that's what I'm saying. If we just like throw out that data, we could have told someone, maybe like thinking from our perspective, okay, someone who's obsessed about avoiding plastic, like let's say 3 or 4 years back, tell them, इस पे इतना data नहीं है. The research on microplastics and like BPA and stuff wasn't as kind of building as it is now, and like pointing in a clear direction. Where we're finding microplastics in plaque in the arteries, ज़्यादा urinary excretion हो रहा है. We're seeing different increased risk of outcomes associated with increasing excretion of that. So someone who's a bit more precautious was taking steps to avoid it based on early research. The thing with early research and people trying to make decisions based on these things, sometimes they might land up being ahead of everyone else. Yeah, because as I said, it's a less chance of confirming, but ऐसा नहीं कि नहीं confirm होगा. Like 5-10%, 5-10%, 15% of things from there do translate, because that's where we get the clues from. So things can pan out. Think if you're avoiding all the additives and you avoided like microplastics from there, you'd have struck one right probably, but then you can land up like getting paranoid about 20 things which probably don't matter so much.
Yeah.
That's the only trade-off.
Yeah.
That's how I think about it. So there's no hardcore like, I think about it in a way, even how I've done it for myself personally. First, fix the bases, optimize the blood health, then got into gut health, microbiome testing, amino acids, genetics, and then like now I'm at a stage where I'm in like advanced biohacker mode. So I might think of experimenting with a certain compound which maybe only has one randomized control trial, which maybe has like a couple of animal studies, showing me like. But you have to do it
for your practice.
You have to do it with the understanding that it's highly experimental, and it's most likely to fail. There's some chance you'll end up striking something.
True.
And I wouldn't even recommend doing that until you're comprehensively looking at everything, because the research on these things is so scant. Kuch human evidence hai hi nahi. You might think like, oh, this is the biggest fallacy I want to address. This whole idea that if something's natural, it doesn't have. This kind of ties into your question about additives also.
That was my next question. Yeah.
People tend to have a fear of the additives because they think, oh, as long as something is Ayurvedic or herbal, or it's coming from my ancient roots. Nothing could be further from the truth. Like,
if you put a green color, everything is natural.
The glucose in the blood is perfectly natural. It's endogenously synthesized. LDL is perfectly natural. It's made by the body. There are many harmful plant compounds that are in different things that are like perfectly natural. You get it, like there are different toxins that are made from plants and stuff that are perfectly natural. If you have it in high quantities, you can land up like landing at the hospital or something with them. So this whole idea that if something is natural, it's fine. Like I've seen it again and again. Every vitamin, every nutrient, every single natural compound, herb le lo, there's like a U-shaped curve. You have a dose ki deficiency hoga, problem hogi, but you can very easily go on the high end and land up causing
problems for yourself.
Issues. So that whole conversation is very foreign. Most people online are like going on about deficiencies. Like I have this XYZ deficiency, se ye hone wala hai, and then I'm going to have these symptoms. Equally important, if not more so in today's time, is for people to have some awareness that bhai, toxicity also can backfire. So if you're just blindly taking random supplements or not interpreting tests correctly and taking stuff, it can easily end up harming your health, and you might cause more harm than good than just like following that kind of approach. So people have to get this naturalistic fallacy out of their head that you just assume the natural world is safe because it's all stuff you've been using.
And stop fear-mongering that if you see any name on this is a common trend, no? If you don't understand any name on the ingredient panel, don't have it. I mean, this is just...
you can very easily land up damaging your health from perfectly natural compounds. As we said, like salt, saturated fat.
Yeah, exactly.
These things, if you just cross a certain threshold which are there in natural foods, you can cause serious damage to yourself in the long run. So it's all about quantity and dose. I would say like it even makes sense to think about being cautious about those things, thinking about maybe animal research and stuff. सब पहले कर लो. Like all the levels I mentioned, it will take anyone if they're starting now like 5 to 10 years to of dedicated study to even get to that place. Once you
Yeah.
get there, you can have the luxury of even thinking about
Or
avoiding
with
these
these
things
things.
and like
That's
thinking
true.
about them. But
That's true.
the impact those will have is very bleak in comparison to how much you can improve your health by focusing on the pillars first. So I don't want to dismiss people thinking on those lines. As I said, like I gave you my take on that, but it's something that should be left for the end.
Yeah, true.
Yeah.
Nice, man. One more thing I wanted to ask you that what is a message to the people who are coming to this conversation with the mindset of that our time on earth is limited और जिंदगी का तो limited है सबकी कभी भी मर सकते हैं तो इन सब चीज़ों का क्या मतलब so what is a message to those people
Think about your relationships, think about your family, think about your loved ones, think about your quality of life. Do you want to just get old and be crippled, or do you want to actually live like a long time while having good health span? So our conversation is not just about extending how many years you live, but how many like actual quality of
life
life
yeah
years you have
yeah
to the extended period of time you're living. And if you like diagnose and do some basic tests early, you can pick up significant things with drastically increasing your
change their
risk.
life
And if you intervene in that, you can increase the number of years you live, you can tangibly increase your quality of life,
yeah
and it will help you in living that one life that you think
yeah true
that you have much better. I understand that the contrary side to the conversation is general people see a lot of people get obsessed with health, and then they go down these rabbit holes, and we've been down them.
we're coming out of those things huh?
And then like I think a lot of the disillusionment people have is they might have a friend or someone they know. It can be us, for example, for our friends. We've believed shit in the past. We've been really evangelical about it, and then we change our mind. So people end up thinking. I've seen this. Like people end up thinking के यार ये लोग तो 3 साल पहले तो इतना कॉन्फिडेंस से इसका बोल रहे थे, अब ये पूरा उल्टा बोल रहे हैं. So ये सब पे पढ़ने का अंदर क्या है? But I would say even with how much you changed our mind, certain pillars have always been the same.
Been the constant yeah.
So if you just follow those pillars, your health would have been like
much better,
much stellar. And even with the things we've changed our mind on, it's not like we totally are against those things now. Like even though I've said whatever I've said about plant protein and plant foods today, certain animal foods can be very important in certain contexts for certain symptoms. It might not be the best for long-term health,
yeah
but for fixing certain nutrient deficiencies like liver, like and even like red meat or something can be like great sources of certain nutrients. Like it's very easy to get iron and zinc from animal foods than it is from plant foods. So certain nutrients are like better in animal foods for people with digestive disorders, severe IBS and stuff. Like there might be a need to do an elimination diet. So it's not like we fell for these things just out of no evidence at all. There are certain times and contexts where limiting plant matter and increasing animal foods do have benefits in certain contexts for people with certain rare genetic conditions and stuff. So yeah, it's all nuance ultimately.
Nice. Now, bro, I'll throw you some sentences and you have to give me one-line answers for that.
Sure.
All right. Now, 3 habits that are non-negotiables for living long.
I would say in terms of biggest impact, cardiovascular exercise, optimizing sleep, and eating in the way that I mentioned. I would say those would tend to have I could probably mention more, but these things I would focus on.
What would be one advice that you would give to teenage Yohan?
Try to avoid the Dunning-Kruger effect.
Try to avoid the
Dunning-Kruger effect. So it's just to give a brief, it's when you are just diving into a field and you're getting a bit knowledgeable about it and you think you know a lot.
Yeah.
But that's the beginning curve. If you stay around that field long and keep exploring, your confidence will keep dumbing down because you'll realize how dumb you are and how much you don't know yet. Like for the tiny amount you knew. So I feel like most of the things I fell for a lot and I've changed my mind on earlier is an outcome of that. So that would be my best advice even for a lot of people. If you're just getting into this or any field, try to it's an impulse, but try to avoid it. Like for the first 1 or 2 years, you will become arrogant, you'll become cocky, you'll become dismissive, you'll think you know your shit and the doctor's all wrong and the entire like world is wrong and you've somehow got the truth because you can see through all the shit.
Yeah.
It's a huge problem of the mind. Like it's a very well-known psychological like phenomenon. So just be conscious of that. We all have our biases and stuff. But time though, like spend good 2-3 years, listen to everyone, be open-minded. After that,
be open-minded.
So be open-minded and have proper filters for skepticism. It needs to be like a combination.
Most valuable piece of advice you've ever gotten?
This is a hard one. That's too much. I've been told. But I mean, specific to the like diet and nutrition conversation is the importance of like this is not some advice I have exactly been given. I have found this through my own experience, and I've also gleaned it from listening to certain people. Is to always, especially in my clinical practice, is to always listen to patients. It doesn't. This is one thing I'd like to kind of leave with. It doesn't matter how many clinical trials something has. It doesn't matter kitna bhi evidence ho. There are 7 billion people in the world. Even if clinical trials have been done on like couple of thousand, there's always a chance that there's that one dude for whom it doesn't work, like who's the
Outliers.
full edge of the statistic.
No.
And I feel the problem with the mainstream medical profession today is the like lack of being open to patient experience and just dismissing everything as an anecdote or something that's a fully made up thing. Like I often see this with patients who come to work with me. They'll go to a doctor, and the doctor, if they don't have a explanation for the symptoms for which there's good published literature for them, but they just don't know enough because of the authority bias, they will tend to shit on the patient only. They'll say, "You're making this up. It's psychosomatic. Hey, nahi, actually, you just have a mental health disorder or whatever." So that tends to be a problem because then people like lose faith in the medical system because of that, because they are having symptoms, they're having real experiences, but then the doctors just dismiss it. So it's always having an open mind, even if like how many of studies have been done, something is still possible. Someone might still have some rare genetic thing which might make them respond to something totally opposite from what the research shows. So while having a deep like grounding in the evidence, you also at the same time, while at least being a practitioner and seeing patients, have to have a very open mind. Like if some of my client, I give something that's extremely safe, like even creatine, and they report that they have it, they have hair fall, they stop it. Even the research on creatine and hair fall is like very preliminary, because we've just seen some increase in DST from taking creatine in one small trial done 10 years ago. I still have to be open for that, because it's not something that's disproven. We could that question can have much more trials being done, and we might find, but it's something that's underfunded right now. So it's very difficult to strike a balance between both extremes. But as like honest researchers and stuff, like you have to try to do that.
Which book or podcast you would recommend to a person who's just starting their own journey of fitness or want to become healthy? Is the best book or podcast to go to?
I would say number one is The Longevity Leap by Seamland. I think that's a very recent book, and it's a great summary of like the best kind of data that we have on the subject. There's Simon Hill's Proof is in the Plants. That's another like great one, kind of just like highlighting the dietary aspects and like all the pillars that I mentioned. That's another great one. And there's this book called Nutrivore by Sarah Ballantyne. So they can be a bit technical, but these are things that actually get behind and be comfortable in recommending, because of how evidence-based the advice actually is. But yeah, start with this thing, Longevity Leap by Seamland. That's a great summary
to start with. Is sugar bad, independent of calories?
So in food studies, the question always is compared to what? Okay, so this is another important thing to appreciate about different food aspects, because for supplement trials and all, it's very different. It's just like a supplement versus a placebo. Placebo is like a dummy pill, a sugar pill that you might compare the two groups with. For nutrition trials, like food trials, the question always is compared to what? So if we're talking about processed like sugar compared to saturated fat, equal, more or less equal. Like no, so someone might just look at that replacement, like replacing saturated fat with refined carbs. You don't see any benefit. But if you replace saturated fat with PUFAs, with like non kind of refined starch sauces, then we see like the actual benefits of like the replacement. So it all depends on compared to what. Like if you're comparing it to trans fat or like saturated fat, you won't see that.
Sugar independent. Is there an if two people are having same calories and one is having high sugar, one is having low sugar, is he at more risk of metabolic problems?
Okay, let me address it this way. So if you're talking about a control study and the researchers are equating calories, meaning they're only letting you have a set amount of food which is matched for calories, but ek mein sugar zyada hai, there will be no difference in weight. There will be no difference in weight outcomes.
Weight, no, I'm talking about metabolic.
Even health.
No, I'm talking about in a general person, not in a metabolic ward. A general person.
So sugar independently, like so we have studies comparing. Actually came across this quite recently. We have a meta-analysis of 102 randomized control trials. That's fucking massive.
Yeah.
You barely have that for
Yeah.
any question. Comparing saturated fat, polyunsaturated fat, MUFA, sugar, and like whole carbs. Okay, all of these head to head. So the comparisons were intricate, but calorie for calorie, sugar did lead to increased insulin resistance and some markers compared to like PUFA.
And other
Yeah,
things.
I think the saturated fat effect was equal in that. And then if you look at polyunsaturated fat, again, to what's polyunsaturated fat? It's mainly like soybean oil, safflower, sunflower oil,
Sunflower, yeah.
cottonseed oil, rice bran, all of these
Canola
seed
oil.
oils, canola oil and stuff. Canola oil is MUFA.
Oh yeah.
Yeah,
Sorry,
yeah.
sorry,
So,
sorry.
I mean, it can get a bit technical, but in general, when we look at these, calorie for calorie, processed sugar, saturated fat, independent of calories, is associated with more insulin resistance. That we see this in this huge meta-analysis.
One piece of advice you'd give to someone who wants to lose weight, but is just just very disheartened looking at the mountain ahead. That how should he start?
कितना मतलब
It's
how
a
much
long
is
journey, man. So, what is your advice to that person?
so on this also my kind of understanding has become very concrete in the last couple of weeks to months. So when all the diet tribes so far, like if anyone's been around nutrition and like following nutrition influencers for a couple of years, we first had like the blow up of the paleo kind of diet, and we had the blow up of the vegan diet, then we had the keto phase and everything, and now it's kind of coming to more like okay, evidence based, like everyone's just trying to figure out like what's actually without having like a strong bias. Some people are still stuck there, of course, but at least some people are like more open minded and stuff. So what happened through all these years is that everyone was trying to evangelize a diet because of they would cherry pick the studies on that and then say, bhai, ye dekho, like this has, and they would try to squabble with tiny differences and say, oh, like the low carb is superior to low fat or whatever. So when you honestly look at all of the research, when things are equated for calories and stuff, and food is given in measured proportion, then participants can only eat how much they're given. There's no difference in like weight outcomes. So don't get obsessed. The primary takeaway is don't get obsessed with whether you should be doing low carb or low fat or OMAD, like one meal a day, or intermittent fasting or calorie restriction. Don't get obsessed about any of these. The important thing is to reduce calorie intake. The macronutrients are not important. It's very very clear beyond like shadow of a doubt at this point that the macronutrients don't matter. Like when you match for calories, like in all of these trials comparing these diets head to head, people have the same amount of
The protein has to
weight
be,
loss. Yeah,
protein has to be
everything else being equal. Like calories being equal, protein being equal, the carbs and fat won't make a difference.
Yeah, true.
That way. Okay, so yeah, I mean that's the like main crux of it. Like don't get obsessed about which, and fat weight gain is a result of us accumulating, like I would say more so like insulin resistance and diabetes is a result of us accumulating fat around the organs, and weight gain itself is a matter largely of caloric excess. When we say that, we might sound a bit reductionist because many people think that we're saying, oh, just like track your calories, and वैसे नहीं है. Everything comes down to calories, but then different foods have different effect on your satiety and how you expend the calories as well. So fiber has been shown to have like more satiating effects calorie for calorie compared to like refined carbs.
Yeah, true.
And like some other
Protein
sources
has
like
high thermic
saturated fat.
effect. Protein has high thermic effect.
Yeah. So again, like protein, some nuances and matters. Like if you're having it in whole food form, like the powders and all don't seem to have the same effect and stuff. But yeah, like that's what I think we've been talking about this offline. That from a weight loss perspective, the pillars should be like focus on fiber and protein. Like I said, 30 grams of fiber if you can tolerate it. If you've not had anything, like work your way up slowly and stuff. If for protein, again, like work to like optimize your protein intake with the exact numbers. I get it. That's just a good place to start, and you have to try to follow either one of these strategies. So you have to restrict calories somehow. You can't expect if you just work out, you're gonna like even within weight loss. Like it's I would say in terms of what's more important, it's the diet. That's more important for weight loss, and exercise would come as a second. Again, so within the diet, you have to find some way to like cut the calories out, and different things work for different people. Some people find it easier to adhere to a low carb diet, and that's great. Even once you understand how to manage long-term health risk, like you can design a healthy low-carb diet also, which is more rich in like monounsaturated fat and polyunsaturated fat and stuff, rather than it being like a butter, ghee, like bomb fest that way. bulletproof coffee and
Yeah.
stuff. Like you can design like a healthy low carb diet, which will help you to achieve good insulin sensitivity, lose weight, and also not adversely impact your LDL cholesterol. So you can do that. You can do a Mediterranean diet, like a low, fat diet overall, where you're having, and even that we know has like beneficial effects in the literature. You can try tracking your calories if that works for you, and just like you don't have to do it
Yeah,
every
yeah,
day,
yeah.
but at least for a week,
Just to
try to
get a
see like, and
yeah,
then try to like be in a deficit. You can do that. You can just like do intermittent fasting, like shrink your eating window and don't snack outside it. Just focus on having like 2 meals in a span of like 8 to 12 hours. You can do one meal a day where you're just having one meal and then you're not having anything else. So these are all different ways
different
that
strategies to
work
adopt.
for
Yeah.
like different. There's no reason to get evangelical
Yeah.
about
Whatever
either of these.
suits you, be consistent
But
and
yeah,
just
and
go.
the important thing, you said it like very well. It's not about what you do for that 1 month or 3 months. It's about what you do for decades, and you
yeah.
can sustain consistently. That will
Without stressing.
give you the effect without getting a paranoid,
Stress,
like about
stress.
hyper focusing on the small things. So for weight loss, like these are the core elements, and of course you want to engage in some kind of like getting 10,000 steps and
Steps and all
upwards
that,
like
easy things. Yeah.
daily, and engaging in some form of like resistance exercise. From a weight loss perspective, these seem to be the pillars. Baki fir bahut hai. You can there are different types of fibers you can increase to improve
The
satiety.
starting point was there. Yeah.
Like GLP-1
Yeah,
upregulators, natural, Ozempic, like many
It's a
things
different
from
one,
that.
yeah.
But these are the pillars
Start to
that I
something.
would think about. And one, not so much from, there's some research actually, it's not like robust and like very late stage as I mentioned, but there's some research that chrononutrition makes a difference. So timing of eating, try to pack your calories like earlier in the day, because there's some research on like just sleep deprivation as well as like eating late in the day, increasing our propensity to how much we eat and our calorie intake. So might be some, but it's not like RCTs or like something. But like there's good evidence to suggest that might be something that's important. But mostly focus on the first two things I mentioned and keep it sustainable. So there, I was seeing some research on this where people who lose weight really fast, so they were looking at like weight loss trials. So somewhere around like 0.5 to 1% of your body weight lost per week is what helps to preserve muscle mass in the long run. If you do some kind of fad diet or like you lose a lot of weight in a short period of time, you will lose a lot of muscle mass, and it's very difficult to like gain back. Also, like it's very hard to gain that back.
Muscle is precious.
Yeah, so treat it like a precious thing. And if you've taken like 5 years to get fat, they don't expect like in 3 months. Keep it sustainable even on the way down, and engage in resistance training like while losing weight. Like all these things are very important, because you want to lose the weight from the right places that way.
Yohan, those were some truth bombs, man.
काफी चीजें like LDL and all we didn't touch on.
We didn't touch on it. I know you will be an all-timer on this podcast. So yeah. But man, thank you so much. I really appreciate you coming, sharing your insights. Thank you so much.
Anytime, my pleasure.
I'll see you soon.